Hearing loss can affect many aspects of life, and some of them are more serious than others. The overall health of people with special medical concerns can be impacted if a loss of hearing goes untreated.
Well, many people aren't aware of that, but there are some connections between hearing loss and other health-related issues. And actually, hearing loss is sometimes referred to as a triple threat because, first of all, it's a disability in and of itself, but also it can accelerate some other disabilities such as dementia or depression. And thirdly, it can affect your health care. For instance, if you're at the doctor's office and you're not hearing what the physician is telling you or your results or what your possible treatments could be, that's going to affect your healthcare outcome, and you may not even be able to hear your caregivers as well. So your hearing loss can be pretty important as far as dealing with healthcare as a whole.
Amy Rupert is an audiologist with Audiological Services of Cadillac. She says that people with dementia and other age-related health issues are particularly affected by declining hearing ability.
Both hearing loss and dementia are very prevalent and kind of insidious, and the person sometimes is trying to use coping mechanisms. So sometimes, even though they're using those coping mechanisms, it can affect their lifestyle and if they're able to live as independently as they would like to as well.
There are special challenges that come with treating patients who have both hearing loss and additional health problems.
It starts right at the testing, because oftentimes if someone is really confused or they're having memory issues, we may have to use different testing techniques. But for sure, in the counseling portion of the appointment, we really have to bring the caregiver in so that everybody's on the same page. Also, sometimes if the patient is having significant difficulties hearing, we may use, this is called a pocket talker. It's just a headset that the patient wears with a microphone so that while we're counseling them, they're actually able to hear the results and the recommendations. And on occasion, not very often, but this would also sometimes be a recommendation for a patient who for whatever reason is not able to tolerate wearing hearing aids, can't afford it, that sort of thing. Not most optimum compared to hearing aids, but this could be another idea as well.
Health issues can be linked to important decisions in surprising ways. For example, the choice of a specific hearing aid can be impacted by the level of dementia that a patient is dealing with.
When it comes to the actual hearing aid recommendations, we're also oftentimes having to kind of tailor those with the dementia or the memory or confusion in mind, because we want to make things as simple as possible. Hearing aids can sometimes have buttons and controls, but they don't have to. Sometimes you can have a very easy remote control, such as this one. It's got 3 buttons. P to change program if we have different programs in the hearing aid, and also a plus or a minus, which very simply can turn the volume of the hearing aid up or down. So not only could that potentially be used by the patient, but it's also easy for the caregiver to see what's going on and to be helpful as far as the hearing aids.
In order to deal with those complex decisions, healthcare providers such as Audiological Services of Cadillac work closely with family members and the patient's other doctors to find the best solutions.
So a lot of times it's the family members who are seeing the confusion or who are seeing the hearing loss, and they kind of spur on the appointment. And so that's why it's so important then for them to be involved in the whole process. And also after every appointment, we're also sending a very detailed report to the physician so that we're all on the same page. And a lot of times we get medical clearance before we fit hearing aids. And so we're part of the healthcare team, and that's kind of from start to finish. Right from the case history information all the way through the hearing aid recommendations.
And proper audiological care for patients with special needs goes far beyond just improved hearing. It can affect a person's overall happiness and quality of life.
So sometimes we can not only see an improvement of quality of life once we fit the hearing aids, but then that will positively impact attitude or depression, those kinds of things we can sometimes see an improvement in. So that's kind of nice that sometimes we see that kind of go hand in hand, because a lot of times the patient who has hearing loss will become depressed and they'll start to isolate themselves. They're not going to go out to bingo because they're not hearing the letters and the numbers being called. So it's sort of a vicious cycle, and oftentimes we're able to break that by providing some treatment.
For My News 26, I'm Kayla Kiley.